there a preference as to which patients should receive? So Abecma and Carvykti. So these are the two CAR T cells for multiple myeloma.
Well, I can take a stab at it, and I would invite then Dr. Goodman and Dr. Kumar to, opine on it, because again, when I see in clinic, I think we do assess them for CAR T in general first, and then based on, there's always our institutions are limited by the slots that are provided by the companies, and they are not, even though they are trying to step up the manufacturing of these CAR T cells, these slots are by and large limited. We don't have an unlimited number. So we have to plan months ahead as to which slot goes for which patient. So that has been so far a very severe limiting factor. Also, I've also seen that, in patients in which we have a concern of, those who have a lot of extramedullary disease or those who have a higher risk for neurotoxicity, we tend to choose probably like we try to weigh if they really need to get Carvykti versus Abecma. So the presence of extramedullary disease, the risk for neurotoxicity, the availability of slots, these are considerations before getting someone to CAR T. But other than that, I think the right answer would be whichever is the fastest CAR T we can get them to, that would be what I would choose. And I invite others for nuances.
Dr. Kumar?
No, I completely agree. I think right now we are not at a point where we can pick and choose. For a lot of the patients, we just use what we have, and unfortunately, there are no studies to compare the two. The only thing I would say that we have implemented in the practice, again, not necessarily based on a direct comparison, is that some of the a little older, a little more frail patients, we often tend towards Abecma versus trying to use the Carvykti. And the younger patients may be a little bit more towards Carvykti, purely based on some of the side effect profiles that we have seen with a slightly higher neurotoxicity with the Carvykti, but also at the same time, kind of a more durable response with Carvykti at this point in time.
Yeah, for me, it's whatever one we can get. And then really with patients with more rapid disease, I'm just going to teclistamab right now, now that it's available. And obviously we prioritize clinical trials in these patients.